Bismillahirrahmanirrahim.
Mussarat Hasssan Arterial Doppler.
मैं कह रहा था कि the best part of the session was the introduction और इतनी ज़बरदस्त उर्दू और इतनी ज़बरदस्त शायरी और इतनी अच्छी इंट्रोडक्शन, मगर हर किसी का दिल चाहता है सुनने का, मगर क्योंकि टाइम कंस्ट्रेंट था इस वजह से हमारे एक दोस्त हैं केपी के अहमद शफी साहब, तो मैंने उनसे कहा कि डॉक्टर साहब ज़रा टाइम कंस्ट्रेंट है तो अगर थोड़ा सा स्पीड अप कर लीजिएगा, तो उन्होंने स्पीड अप इस तरह किया 786 समझ गए आपकी क्या कहा मैंने 4264 और उन्होंने 4-5 गिनतियाँ दी और कहा कि लेक्चर ख़त्म हो गया। तो मैंने कहा कि डॉक्टर साहब इतनी तेज मैंने नहीं कहा था, तो मैं 786 पूरे ही करूँगा। बिस्मिल्लाहिर्रहमानिर्रहीम। It has been a very nice meeting this morning and afternoon. It was a pleasure to listen to all the speakers, and as Dr. Sabi was telling this morning, the same is true for me, that I had learned a lot during this session. Once I was attending a FIGO conference in Kuala Lumpur, and President Mahathir Mohamad was inaugurating it, and he said in his inaugural speech, if I give you $1 and you give me $1, we will be having $1 each. But if I pass on some knowledge to you and you pass on some knowledge to me, we will be rich in knowledge. So that's what happens actually. Anyway, without wasting any time, I divided my talk into basic and advanced, but I'll do the basic and leave the advanced portion because of the time constraint. So please bear me out. Bismillahirrahmanirrahim. In the name of Allah, the Gracious, the Most Merciful. We'll be talking about the arterial peripheral Doppler. How Doppler is presented by audible, spectrum and color. And you can listen These were two different spectrums and the sound was different. There are people in the world, by listening to the sound, they can diagnose the abnormality. So for that you have to listen to this sound very carefully, and even Peter Burns, my teacher, he would make the sound of different pathologies by his mouth because he listened to that sound so. Color is there to tell you where is the vessel, and then once you got the vessel, you have to take the spectrum of that particular vessel. So color shortens the examination time. Spectrum is the integral part of the color Doppler and is plotted on x-axis and y-axis, which you can see right here, is the height and against the time. We have two components. Systolic component represents the velocity and the diastolic component represents the amount of blood flow, and we'll talk about that as we go along. If the sample gate of the Doppler is wide, you can pick up the artery and the vein together. The vein will sound something like. On the contrary, the artery is going to sound. So you see the systole and the diastole, which is the integral part. Since I've been asked to talk about arteries are usually biphasic and triphasic. However, in certain physiological and pathological conditions, they can become monophasic. This is the scan of the renal artery, just to show you that I will scan one picture of the organ. And when the RI, just to give you a quick tip on that, all organs are vasodilated, hence all vital organs RI range between 0.50 to 0.70. Very universal. Anything more than 0.70, high resistance. Anything less than 0.50 is low resistance. We have got gray shades on both sides, so we don't worry about 0.75, but anything above 0.80 is high resistance. Anything less than 0.40 is low resistance. So avoid the gray shades, and I've given you the middle figure right here. All peripheral vessels are vasoconstrictive. Vasoconstrictive, and that's why we have triphasic flow. Triphasic flow is that there is resistance onward. That's why the flow bounces back and the diastole is divided into the two components. That's why we say it's triphasic. All peripheral vessels are triphasic. They can become monophasic, they can become biphasic in physiological and pathological condition, which I'm going to highlight. It's a monophasic flow. That means there is no diastolic component in that. Systole is there, diastole is not there. Positive Doppler shift is made above the baseline and represented as red, and anything which is made above the baseline is the positive Doppler shift. On color, it represents red, and when it is negative Doppler shift, which is made below the baseline, is painted blue. So artery is not red and blue. Towards the probe is red. Below the baseline is blue, and that can reverse depending on which vessel you are seeing. So that's the reversal. Here we can see the vessel which has become. This is biphasic, it's not triphasic, and in physiological conditions we can get biphasic of the vessels, and we are going to talk about that as well. So this is biphasic, means two phases. Systole and diastole are both on one side of the baseline. You can change the polarity at a touch of a knob. That does not mean that it is reversal of flow, because the systole and diastole is on the same side of the baseline. That's what we call it as polarities change. You can check somebody who is misusing this technology by looking at the color. If the color is down, polarity has been changed, and it's not reversal of flow. If the red was above and the spectrum was made below, then it is reversal. Acceleration phase is a very important component of the spectrum in artery, and that is a sharp rise in peripheral vessels. If there is no sharp rise, there is some problem which we have to diagnose, and we'll talk about that. The arrows are pointing out to the sharp rise, which is this, and has got one strong velocity, whereas the deceleration phase has got various frequencies, which we'll talk about in this portion. So it is at that descending portion of the spectrum which has got a range of frequency, that's why it is thick. And that's the arrow pointing to the deceleration phase. Now they constitute to a problem, if there is a problem. Peak systolic velocity is the highest point, and when we have to measure the velocity, we have to go to the peak, and that will determine with what force the blood is moving in that vessel and how fast that blood is moving. So the arrow is pointing, if you lower the Doppler gain, the peak will be shortened and the wrong diagnosis. It's important that the gains, like you have got B mode gains, you have got Doppler gains as well. Any Doppler gain which is low, you can get the wrong diagnosis. End diastolic is the end point of the diastole and represents the amount of flow in an organ, which is very helpful in measuring the end diastasis. Since I was involved with Doppler way back in 1982, and my first Doppler machine was in 1986 in Karachi, I have done a lot of work on that, and each and every component I enjoy and point out that this may be the reason for the problem. Spectral width is the broadening of the peak, which is seen by the arrows right here. Any turbulence, you have to measure the spectral width. And then we have got a window which is called echo-free space or black area, which is signifying that there is no turbulence. Whenever we do the peripheral vessels, if there is stenosis, if there is disturbance, if there is aneurysm, that's what we look for. So this black area which is pointing right here is the window. Every component of the spectrum should be studied. When we talk about triphasic, because I've been given the topic of the peripheral, is a type of flow in which the systolic component is seen above the baseline and the diastolic is divided into above and below. It is a high resistance flow because अगर अल्लाह मियाँ ने ये high resistance ना बनाया होता तो हमारे पैरों में से रोज खून निकल रहा होता अगर low resistance होता. And that is why अगर मैं एक बॉल इस एडवर्टाइजमेंट पे मारूं तो ये क्योंकि पर्दा है ये पर्दा हिल जाएगा, मगर अगर सॉलिड दीवार पे मारूं तो वो बॉल वापस आएगी. This is what happens in this phenomena, that when there is a peripheral resistance आपके पैरों में, वहाँ से वो bounce करके वापस आता है blood. That's why you get this triphasic flow. So it is important to understand that. There is a term called sufficient runoff in this triphasic flow. What is that? If your PRF, pulse repetition frequency, is low or high, you miss this component, and it's very important information as seen in this one. And I'll show you the next one right here. Here is the acceleration phase, deceleration phase. From this 0 point aortic closure to this is the aortic closure. From this point to this point is the deceleration phase, and this portion is called sufficient runoff. And this is from the 0 point to this, and this is the division of the diastolic component below the baseline and above the baseline, which makes a triphasic flow. So this is the norm. When does that happen? It is below the renals in the aorta. जब तक के किडनीज को ब्लड सप्लाई नहीं मिल जाती, जब तक जो है ये बाइफेजिक होगा. जैसे ही वाइटल ऑर्गन को ब्लड सप्लाई मिल गई, then the aorta becomes triphasic. And this is triphasic, and you can see in the aorta there is a lot of filling of the window because of the turbulence. If you have heard about monophasic, biphasic, triphasic, you should also know about quadraphasic. And quadraphasic is split into three components. If you are doing the ultrasound of a child, then you will see quadraphasic, and here is the example. Somebody might get up and ask me, Doctor Sahab, iski aliasing to kam kare? To study the spectrum just below and above the baseline, I would prefer to have the low PRF. I would not bother about the aliasing happening in this, which is an artifact, because I am interested in this is the deceleration phase, sufficient runoff, and goes and comes back because of the high resistance in the children. Monophasic is generally attributed to the venous flow, but arteries can also be monophasic if diastolic component is obliterated. Example is the partial obstruction of the iliac artery, which may lead to monophasic flow in the femoral, and that's what we are interested in, which is also called as Taurus Powers flow. Here you can see the vessel, which is monophasic. What is Taurus Powers flow? And the Taurus Powers flow is that sometimes you cannot see the site of stenosis. Distal to that, you see the Taurus Powers flow, making the diagnosis that proximally there is an obstruction. And we have not seen the obstruction. On the basis of the spectrum, I can say this is 40% stenosis, 60% stenosis, or more than 80% stenosis on the basis of the Taurus Powers flow. And here is the vessel, which is the femoral artery, and the wall is thick, so it is hardened. Maybe because of any problem, we are not discussing that. When we did the Doppler of the vein, we saw this, but if we see the same pattern right here, which we are going to show you in the other image, then that means it is the Taurus Powers flow. Never mix up vein with the artery. Taurus Powers in ICA, renal and femoral. We call it, there is a term called Larish syndrome, which is aorta-iliac disease. When there is a narrowing of the aorta-iliac disease, the blood supply to the femoral is decreased, and the patient may talk about claudication. Calf muscle mein dard rehta hai. You have to do the ultrasound and the Doppler of the leg. And here is the right femoral. I showed you the vein, and I'm writing that this is the artery. This is the vein. And in the artery, we saw this Taurus Powers flow, which means that aorto-iliac disease is more than 80% stenosed. That's why less blood is flowing. आप लोग ड्राइविंग सब करते होंगे, अगर अपहिल जाना पड़े ड्राइव करते हुए और आपकी स्पीड हो 100 miles an hour. I'm giving you the practical example to understand